just got to put a little water on her and she's good to go. Number of times I have to tell people not to use soap on the nether regions.
Why is it bad to use soap on the nether region?
Because the vagina is acidic and soap is literally alkaline. It's basic. So it screws up your pH, which means it can cause odor issues. So people use it because they think it's going to fix the problem. It is not going to fix that. It's going to probably make it worse. And the vagina is a self-cleaning organ.
What if people, but what about the ones that say, oh, gynecologist approved, Summer Eves or whatever it's called?
Yes, it might be approved by a couple of them, but it still is probably not fully pH balanced. Plus, here's the thing, even if there's something like Summer's Eve that has a decent pH to it, you still don't need it, and it can still cause odor issues. Plus, sperm is very alkaline. It's very basic. If you're having more frequent sex, then you also need to be very regularly cleaning, because that can cause odor and stuff.
Oh, interesting. So it can be like almost like soap, as far as like it has the same effect because it's alkaline. But what if people are like, my junk smells?
It's probably normal.
So what would be normal smelling?
It depends what you eat.
Really?
Yes.
It depends on what you eat?
So if you, for example, eat a ton of fruit, you'll notice it to be much fruitier. Or if you eat a ton of cheese, you'll notice it.
Shut up.
I'm serious.
I didn't know that.
Yeah. So part of it has to do with you excrete what you put in general. But part of it's your own natural, just in the same way that everybody's sweat smells differently. It's like the same idea.
I want to talk about something very intimate. So you are a pelvic floor therapist. You see lots of lips, lots of tunnels. Yes. Can we please discuss variations in labia appearance? I see them all the time as well, because I do transvaginal ultrasounds. The textbooks only have one kind of labia, and most textbooks do not discuss variations in labia. Other variations of labia was in the Grey's Anatomy textbook. All it said was that it's very rare to have something different than a clam, or it only happens after menopause.
That's not true.
I know it's not true, but what do you have to say about that? What are your thoughts about that?
No, it's totally normal for there to be all kinds of different colors and styles and shapes. But no, there's all kinds. There's a lot of people who's like, the inner labia is way more central and exposed. And then there are some people who have like really, really small labia majora. And then other people who have really, really large labia majora. Other people whose like labia minora, so again the inner part is like sucked in there a little bit, and other people's that are just out and about a little bit more. Sometimes the color really varies between the two, and sometimes it's more similar as well. It can be as varied as any other part of your body compared to somebody else's. I think part of that is lack of women's health knowledge over the years, and lack of like awareness of people actually putting time and effort into research on like, I don't know, anatomy and like women's health in general. Part of it is corn culture.
You recently did a series on hysteria, and one of the treatments for hysteria was manual stimulation by a doctor to induce spasms, aka exactly what you think it is. Yes, that was one of the treatments. Do you not watch my TikTok, Noelle?
No, I haven't.
Okay.
Sorry.
Anyways, they were worried about it becoming like convoluted with like an actual like intimate act. And so some doctors promoted the idea of like hurting the patients as well, so that it wasn't just like pleasuring patients. You think that this has anything to do with why so many gynecological procedures do not have pain medication involved?
Oh, interesting.
Insertion of IUDs, removal of polyps, or just anything to do with the cervix, because they say the cervix has no nerve endings or any. I mean, like my cervix does something a little different to me. But by 1910, it was considered alternative medicine to do that kind of treatment for hysteria, because of course we have to move on from that. We're going to commit people to insane asylums, to do lobotomies. I mean, come on. I'm not saying intentional, but systemic, of the stigma of the female pelvis and the female reproductive organs, and so could be a systemic issue throughout medicine when it comes to female pain management of reproductive things, because people will even get C-sections and they only get ibuprofen and Tylenol. To 7 layers cut through, 7 layers for a C-section, and some people just get Tylenol and ibuprofen. As a pelvic floor PT, pain during intercourse, how normal is that? And when does it usually occur?
Okay, so what I tell people is it's not normal. It might be common for some people, but it's not normal. It's somewhat normal, have pain your first time. Okay. But, and then sometimes postpartum, maybe your first time. Yes. But really, other than that, I would say it's not normal.
Okay.
So I see a ton of people that have pain with intercourse that younger, so they have like maybe some kind of vaginismus issue.
And vaginismus, just in general though, just real fast, it's when it like tenses up.
Yeah, your body has a like a involuntary response to any kind of insertion at all.
And that can happen. Can that happen anytime in your life?
Yeah, theoretically yes, but it's more common. Like I've seen it more common like in younger women. Like, I can't use tampon. Like I've never been able to use tampon. Kind of a thing. So I see that very commonly. I see women postpartum that have like prolonged pain. And that could be because there's scar tissue from tearing, episiotomies that's not been healed really well. Pelvic floor tightness that's resulted postpartum too. And then I see it a ton in postmenopausal women as well because they have decreased estrogen, so they have more vaginal dryness and decreased muscle like elasticity, decrease like all of, like muscle girth, like all of that. And so I see that super commonly in postmenopausal women too. And then everything else in between. But oftentimes, like, we can treat it pretty successfully.
And not just with like lubricant, like you're talking about actual like manual therapy.
Yeah, manual therapy to the pelvic floor for sure. Other kinds of like exercises. So there's stretching, there's breathing techniques, there's all kinds of other things that help. Because here's the thing, the problem in that case is likely your pelvic floor. And so when you treat the problem, not just the symptom. And so when you treat the problem, then the symptom that is pain with intercourse. And you might also have other symptoms too. Urinary urgency, frequent leakage, like all kinds of stuff. Constipation, all those things will usually resolve if they're correlated with that too. But it can depend on what's going on and what your stage of life is as far as what might be another culprit.
Well, what about people who are like, oh, well, I never had a baby out the one hole. I did the convertible style one, the C-section, the sunroof. Do I have pelvic floor problems? Like, how could I have pelvic floor?
Yes, you absolutely still can. So the pelvic floor is like this hammock. It's a hammock that supports literally everything in our pelvis. That includes the uterus and the vagina. Also, can I say vagina? Whatever.
Vajayjay.
And then the urethra, bladder, and then like the rectum, to the large intestines. Injury or trauma to anything in that area, the pelvic floor muscles can respond by tightening. Just like your body, if you injure your shoulder, you automatically keep that arm close to your body because your muscles are muscle guarding. Same thing can happen to your pelvic floor.
What I find fascinating about the C-sections in general is there's no other surgery like it where you're cutting through 7 layers. And then we just act like it's like, oh, well, just bounce back, honey. Like, I don't...
Yeah.
7 layers?
Yeah.
7 layers. Come on. Nobody gets physical therapy.
No one teaches anyone about, like, scar. That's one of my biggest pet peeves.
The scar tissue thing? That was huge.
Yeah, even after just abdominal surgeries in general, I feel like it should be
like, I think the statistic is like 94% gets adhesions from abdominal surgery.
I believe
and adhesions being like scar tissue that connects to other tissues in the body.
Pain and all kinds of other issues and stuff.
That like sticks to things that shouldn't be stuck. Tight pelvic floors. And no, it's not a good thing.
It's not a good thing.
Yeah, so let's talk about that. How do you know that you have, that is your problem? And what should you avoid if it is your problem? What should you do if it is your problem?
So, tight pelvic floor can look similar in some ways to people that have weakness in their pelvic floor because you can have leakage. But specifically with tight pelvic floor, you're also often going to see pelvic pain. That could be pain with intercourse or pain with any insertion. That's similar, like tampons, pap smears, anything like that. Abdominal pain issues, constipation. I often see more urinary urgency and frequency with tight pelvic floor. So people that are urinating like every hour or every hour and a half, when really ideally the goal is to be somewhere within like a every 2 to 4 hour range. So if you're urinating really frequently and then you get, especially if you get that urge a lot, urgency where you're like feeling like I gotta go right now quite often, and then especially when you go and there's not a lot that comes out, or you're getting urgency and you're going, like I said, every hour and a half. Additionally, a lot of times these people can have difficulty emptying their bladder or bowels. Can also be a sign because your pelvic floor is not relaxing enough for you to be able to empty. So those are probably some of the most common signs.
If you have those signs and symptoms, and let's assume that those signs and symptoms are from a tight pelvic floor, what are the exercises that you should avoid doing, like your pelvic floor?
Do not do Kegels.
Okay, Kegels is not a one-size-fits-all.
No. I explain that to people a lot, that the pelvic floor is like any other muscle in the body. It needs to be able to lengthen and it needs to be able to contract. So if you think about, I use the bicep muscle all the time. If I don't have full motion in my bicep, so I'm stuck here all the time, I can try to pick up something, but it's not really going to be as strong as it's going to be if I can do this. So If a muscle is tight, it's not going to be strong. And if we keep trying to strengthen it like this, then we're just going to make that tightness worse. So Kegels definitely going to make a pelvic floor, the tight pelvic floor, either worse or just at least not improving at all. Treatment wise, if you're coming into the clinic, there's internal pelvic floor work that can be done, but stretching is a fantastic way to start at home. So doing like yoga kind of stretching, butterfly stretch, I give all the time. Happy baby stretch, child's pose is great. Anything that's really going to open up the pelvis and the pelvic floor. Also deep breathing, because that will relax your sympathetic nervous system, which will help reduce the tension in your pelvic floor. And also I start having people pay attention and check in with their pelvic floor during the day. If you're feeling tension or tightness in your body, other places, like these guys get tight or your jaw's tight, if you immediately check in with your pelvic floor, you may notice that you're holding a little bit of tension, almost like a Kegel there. And so then in those moments, I tell people to work on their breathing to relax. So it's also kind of awareness of what's going on with those muscles that can be super helpful.
What causes it?
So many things can cause it. It can be a response to pain if you're postpartum and you delivered, or you have a history of trauma, or you have pain from like endometriosis or PCOS or interstitial cystitis or any of those kinds of chronic conditions, fibromyalgia, something like that. Like our body often automatically responds to pain anywhere by tightening the muscles around it to protect it. Same thing with the pelvic floor. Also, if you're a person that carries stress in their body, which is really everybody, but if you deal with anxiety or high stress situations, you're in a fight or flight state, then your body's probably holding tension. So that's another component. And it can also be response to any other kind of condition that can be causing like pressure, pain in the pelvic floor area. So those are a few common things that can cause it.
If someone's like, yep, I want to get checked out with pelvic floor therapy, how would somebody go about making that happen?
It depends a little bit on what state you're in. Illinois is a direct access state, which means technically you can make an appointment to have an evaluation done without a referral, but most hospital-based clinics, most like regular chain outpatient clinics will require a referral. But if you're in a state where that is direct access is an option, you can always call to make one. However, by and large, talk to your primary care doctor, your OBGYN, your GI, or your urologist to get a referral.
Okay, so any of those 4 doctors would...
Yeah.
Does anybody ever give a hard time, you think, about giving a referral to pelvic floor?
I have never had... Okay, where I'm at now, I haven't had that happen before. The only thing I think I've had is some physicians who have said, like, I'm not sure if it's going to help you, but sure, you can try it. In general, I think most people are receptive to it because it's a pretty conservative kind of treatment. It's not, like, risky. So if somebody was to kind of push back on that a little bit, then it's a good time to maybe educate them a little bit on what you know and why it can be helpful.